Thank you very much. Madam Secretary, a couple of things with regard to the Recovery Act funding. One is, as you know, it's very difficult oftentimes for communities of color to access federal funds for grants. And so I appreciate the diligence and the urgency that HHS has placed in putting these funds forward that we provided in the economic recovery package. But I wanted to see if you had any specific outreach efforts for the African American, Latino, Asian Pacific American, and Native American communities to be able to compete with these funds. And if so, how you're coordinating that. And also ensuring that minority serving institutions such as Hispanic serving institutions and historically black colleges have the benefit of being able to understand and compete for these funds so that they can certainly access them. And then secondly, I wanted to just ask you about mental health services as a part of the economic recovery funding. I know we provided funding for a variety of healthcare strategies and initiatives, but how does mental health fit into that? And finally, thanks to Congressman Kennedy and others, his father, Senator Kennedy, we do have mental health parity now as the law of the land. And so have we considered that in the allocation of the funding under the Economic Recovery Act?
Well, I do know that in the Recovery Act, Congresswoman, there's a new stream of funding that is targeted for capacity building of community and not-for-profit organizations that I think is not exclusively targeted to minority groups, but certainly would be an applicable source of funding to build capacity in the kind of neighborhood resource groups that are often so vital to deliver services. I think that back to Congressman Jackson's notion, there are also an expansion, as you know, of community health centers and workforce and community health centers, of minority student loans being paid so we can increase the number of health providers. So I think there are a series of strategies that are in that umbrella that are really aimed to drill down services to appropriate populations. This 2010 budget request does include an increase request for mental health services, particularly for children. It has a grant proposal to serve 11,000 more children and provide services to 35,000 additional parents and siblings, something that I know Congressman Kennedy and others have worked on diligently. So I think expanding those health services is an important feature of this budget request.